The effects and goals of Cox Technique are well documented. James M. Cox, D.C., also a chiropractic radiologist, is the inventor, author, and instructor of Cox Technique protocols. He first coined this technique, Flexion distraction, in the early 1970s. He has written a textbook on low back pain, as well as neck, shoulder, and arm pain, documenting the biomechanics, mechanism, diagnosis, examination, and treatment of spinal pain conditions. The first effect of Cox Technique is that it drops intradiscal pressures to as low as a negative 192 millimeters of pressure. This was demonstrated in the Health Resources and Services Administration funded study into the biomechanics of flexion distraction. It was published as part of the proceedings of the International Society of the Study of the Lumbar Spine, which was held in Singapore in 1997. The second goal is to increase the area of the foramen up to 28%. In a compressed spinal canal, the foramen is narrowed. Flexion distraction is able to decompress the spinal canal, opening the foramen. The third effect is to increase the intervertebral disc height to remove tension on the annular fibers and spinal nerves. Here there is compression. During Cox Technique, decompression. The fourth goal is to restore vertebral joints to their physiological relationships of motion, or realign the spine. The fifth goal is afferentation. The goal of Cox Technique is 50% relief of pain in 30 days. If this relief is not attained, a referral for more tests or surgical consultation is requested. The 50% rule guides the treatment of protocols of Cox Technique. 50% relief of symptomatology reduces all visits by 50%. For example, if a patient is seen daily, she would be seen every 2 days upon 50% relief of pain. If the patient is seen twice a week, he would then be seen just once a week. For more information, please visit coxtechnique.com/research.asp or access the article by Cox et al. Titled Distraction, Chiropractic Adjusting, Clinical Application and Outcomes of 1,000 Cases, published in Topics in Clinical Chiropractic in 1996.